Welcome to Atrium Health Navicent Knows Health. I'm Cindy Busby and I'm here today with Dr. Dennis Ashley. He's a board-certified trauma surgeon, and today we're going to talk about his practice here in Central Georgia. Dr. Ashley, thanks so much for being with me.
Thanks, Cindy, for having me.
First thing, would you talk a little bit to our audience about what is a trauma center? When it comes to comparing them to emergency centers, what is a trauma center?
Well, there's a big difference between a trauma center and an emergency center or an emergency room. Most people, if you ask someone, they'll say, if you ask them if they are near a trauma center, they'll say, oh yes, there's an emergency room right down the street, or an urgent care. And really, that's not a trauma center. Those are great facilities that take care of a wide array of sick patients, such as a laceration or maybe a heart attack. But when it comes to big time trauma, they really don't do that. That's more for the trauma centers, which have surgical teams ready to go 24/7.
When it comes to looking at the state of Georgia, can you talk a little bit about the trauma network that Georgia has today and where Navicent plays a role in that?
Sure. The trauma coverage throughout the state is a lot like cell phone coverage. If you're in downtown Macon, downtown Atlanta, Savannah, you're near a trauma center because the medical center is the only trauma center in Macon. So you're near a trauma center. However, as you get farther away from those areas, it's like cell phone coverage. There's areas where you don't have good coverage. So I've been working with the State Trauma Commission trying to make sure that wherever our citizens are injured, they have access to high-level trauma care. And that's what we're trying to build throughout the state, is a system where there's no drop calls, there's no drop coverage, if you will, no drop trauma coverage, but each citizen, no matter where they are in the state, they can get to a trauma center very quickly.
What would be the optimal system when you think about that? What's the average time that you really want someone who's traumatically injured or has a level, a high-level injury to get to a trauma center?
You've heard a lot about the golden hour. There's nothing magical about 60 minutes, 59 versus 61 minutes, but certainly right about 60 minutes, if we can get you before then, our chance of survival really goes up. So for those critically injured patients, wherever they're hurt in Georgia, we want to get them to an appropriate level trauma center within that golden hour.
You talk a little bit about what a trauma center has to have ready to go. Tell us a little bit about who's in-house all the time at a trauma center.
That's the big difference between an emergency room and a trauma center. Emergency room has some staff, limited staff, or maybe a rather large staff, but they don't always have the surgical backup. Trauma centers have neurosurgery, orthopedic surgery, trauma surgery, critical care specialist, heart surgery. We can go from the emergency room to the operating room within minutes. And so by having that high level of specialty care backing up the emergency room, that gives us tremendous power to save lives because we can get patients that are bleeding to the operating room very quickly.
When it comes to the Level 1 Trauma Center at Atrium Health Navicent, we are ACS verified. Can you talk about the American College of Surgeons verification and even how that differentiates us even more from other Level 1 trauma centers?
Well, the American College of Surgeons is the national body that verifies trauma centers, and we are verified by the American College of Surgeons and at the highest level, a level 1, which means the most comprehensive or sophisticated trauma care that you can have. We have to be able to cover all trauma emergencies, and we are verified by the American College of Surgeons.
What is the trauma center's role in survivorship? So once a patient comes in through the trauma center network and they're treated here, does the trauma center have a role in following them and their, even for research purposes, about how they survive and overcome their injury, their traumatic injury?
Yes, we actually have a trauma survivors network that is actually really anchored here at the medical center. So anyone that's listening that's been in a traumatic injury, that's feeling left out or lonely, or there's a lot of depression associated with trauma, we have a support group for you. It's very well run, and if you'll contact us, we'll be happy to make you a member of that group.
As a trauma surgeon, there are lots of technologies that your discipline is always keeping up with. Can you tell us a little bit about some of those technologies and some of the ways that you are treating the most high velocity accidents that are coming to the medical center?
Well, one of those involves rib fractures or broken ribs. or crushed chest. You'll hear different terms people use to talk about it. And we've been on the cutting edge here with managing rib fractures at the medical center. Several years ago, technology changed to where we could actually plate ribs. And what I mean by that, take ribs that are displaced or grossly broken, line them up and put titanium plates and screws on those ribs to bring them back together. And what we found by doing this was that decreases pain, decreases their time in the hospital, and speeds up their recovery. Even decreases narcotic use in the post-discharge period when they come back to the office. It's amazing with this technology that is so new that there's many hospitals in the country and many hospitals in Georgia that don't even offer this technique. But we're fortunate here that we have Dr. Benji Christie, who is a national expert in this and has given many talks on rib fixation throughout the country, Dr. Eric Long, and myself. And with this three-person team, we've been able to do over 300 rib plating cases and really do research in this area as well to actually really push us to the next frontier on rib fracture management.
When we talk about rib fractures, what was the previous or the legacy way of treating ribs prior to rib plating?
This is the amazing thing, Cindy. I've been doing this for 30 years, and probably for the first 20 years of my career, and I'm not alone, many surgeons are in that boat, we managed rib fractures in the wrong way. These are terribly painful injuries. People 6 months later, a lot are not back at work. 2 months later are not back at work. They're sleeping in recliners at home because they can't lie flat. It's a terrible, terrible injury. And we would just give them narcotic tablets and say, you know, you're going to be okay, and they'd come back to office every few weeks and we'd renew their prescription. But with this new rib plating technique, we found out that the patients come back to office and they're ready to go back to work. They don't need a refill on their prescriptions. It's been very amazing and really a paradigm shift in our practice over the last 30 years.
Is rib plating something that is temporal, that you eventually remove it, like some plates and screws are removed in orthopedic fixation? Is it external to the body? What's the...
These are all internal plates, and we've actually done research on absorbable plates, where we place absorbable plates that your body absorbs in about 18 months. And so they are sort of temporary, but long enough to let the ribs heal. And we have a new study coming out. I don't have all the data analyzed yet that I'm ready to present, but we've actually compared the metal plates to the absorbable plates. And you'll be hearing more about that maybe in another talk soon.
Is rib plating one of those things that you really are going to find at a verified level 1 trauma center?
Usually it's a trauma center because these patients are usually really critically injured, and you need all the other things that go along with the management of that patient, such as the critical care specialist and the other specialties, because it's unusual to have a patient that just has rib fractures. They usually have other injuries as well.
Is there a connection with orthopedics as a trauma surgeon? Are you also working with other specialties around rib plating, or does this tend to be within the trauma surgeon's purview when they operate on the patient?
Typically, the trauma surgeons, this has sort of fallen into their arena, if you will, or their area of expertise. The trauma surgeons do the rib plating, but then obviously we call on our orthopedic colleagues to do the acetabular or hip fractures, and leg bone fractures, and arm, and so on. And then our neurosurgery colleagues, obviously, to do the brain injuries. So we work as a multidisciplinary team. We all have our role, and by working together, you know, one person may have 3 or 4 different surgeons on their case.
Well, thank you for telling us so much about this technology.
You're welcome. Thanks for having me.
Thank you. And thank you for joining us at Atrium Health Navicent Knows Health. If you'd like to know more about Dr. Ashley and the Level 1 Trauma Center at Atrium Health Navicent, please visit us at atriumhealthnavicent.org.